According to the Centers for Disease Control, there are 1.4 million documented cases of mild to severe traumatic brain injury each year in the United States. Single photon emission computed tomography, or SPECT brain imaging, is the technology experts are using to show functional brain injuries.
Other types of scans that people are more familiar with, like a CAT scan or a CT scan or an MRI, look at the anatomy of the brain. They look at the structures in the brain, but they can't tell you anything about how it's working.
When the consequence of a brain injury becomes a matter of law, CereScan SPECT Imaging is a powerful tool. The ability to show that an injury actually exists, coupled with expert analysis, makes all the difference in the world to law firms that are pursuing this type of personal injury litigation.
There's nothing better than a picture, and it's a fact that brain function imaging has been established as the gold standard for showing the actual measurement of brain functioning.
The ability to successfully document a brain injury, however, is not enough in a legal proceeding. To provide the highest level of evidence that lawyers require, expert analysis of the images themselves is a key component to winning a case.
There have been a number of cases in California where the SPECT technology has not been admitted into evidence because the expert that was utilizing it didn't have the knowledge or the expertise to be able to convince a jury that it was usable for the particular purpose.
It is a well-known fact now that there are several chemical agents or traumatic events that may alter the brain function indirectly by altering the perfusion pattern and hence the metabolic activity. For CT or MR to capture that effect on the brain, one has to go down the hill to the extent that the anatomy is changed, and then it would be too late to intervene and help the patient.
Whether it takes the form of a comprehensive written report or testimony in a courtroom, CereScan SPECT Imaging provides an accurate and defendable story. The quality of CereScan's brain imaging process is backed by the extensive experience they have in scanning and reading a caseload of more than 2,000 past patients. CereScan's reading physicians compare and contrast each patient's results with those of a scientifically accepted and objective normative database.
Comparing the normal data with the image that we see just helps us in deciding whether the perfusion pattern we see is within normal limits or not, and if we see an abnormal pattern, is it persistently seen on such similar cases. This increases our confidence level in calling whether a specific pattern is seen with any specific pathologic entity.
Most hospitals are sort of eyeballing the scan. Some do compare it to a normal database. Many times they're sort of doing it by memory. Okay, I know what that looks like, so does it look like this, And very prominent neuroimaging, nuclear medicine physicians have said this openly, that that's what they do.
In cases involving issues of psychological functioning, for example, if you can hook up a battery of psychological tests with an expert who understands that, and then utilize the brain imaging to show that it is consistent with the damage that's reflected in the psychological testing, it is boffo, in terms of its impact on a jury.
Brain imaging is relevant. Brain imaging is reliable. Brain imaging is an accepted practice in both the medical and legal arenas. To further its understanding, a white paper researched by the law firm of Holland & Hart is available to provide trial lawyers with the type of critical background information they need to pursue cases involving mild to moderate traumatic brain injury.
Up until 2006, there were 130 cases of reported application of this particular technology in courtroom proceedings and in administrative proceedings. And what we're going to show is that the 80% of those cases were admissible for various reasons and purposes. And we're trying to show the factors that influence the judge or not in a comprehensive analysis of all the cases dealing with admissibility and the factual issue at hand, so that you can have a pretty good idea in terms of a master map as to what applications of this particular technology will be useful to a trial lawyer.
To obtain a copy of the white paper on SPECT brain imaging, simply click on the appropriate tile, fill out the required fields, and download a free copy of the paper.